Mm-mm. Welcome to the conversation, my friends. Thanks for checking it out. I appreciate you being here. Today, we're going to talk about. I've got some clips. I've got a clip of. It's a PBS clip, so take it with a grain of salt. Take everything with a grain of salt in 2025, right? uh, Talking about RFK Jr.'s statements on VACCINES, and then I've got some other clips queued up about general health and well-being in general. As always, I would love your comments. If you leave a comment, I will try to get to it. And if I'm in the middle of a video, I'll get to it after I share the clip. Before we jump in, let me do some shameless plugs. Of course, if you want products and apparel for conscious creators, right? Reminders that what you think about, you bring about, and what you focus on expands. Check out the Focus and Flow store at focusandflow.co. In fact, I'm having my coffee this morning out of this mug here, and it says, assume you are what you want to be, walk in that assumption, and it will harden into fact. Neville Goddard, one of my heroes. Pick up the Great Awakening Guide at greatawakeningguide.com. That's all the best resources all in one place. Check out One Life, which is right there, which is the system that I created to help you complete your mission in life, right? Do your purpose. And if you want to be on my weekly video email newsletter, you can do that at gmarkphillips.com/subscribe. And I'm going to give you the heart and soul of One Life, which is how to find your mission in life. Okay, I think that's everything. Let's jump in. Let's watch this first video, and then we'll. It's a little bit long, but it's well worth it. Let's go here.
In that hearing today, Secretary Kennedy made a number of questionable or misleading claims about vaccines, COVID, and the health of Americans. Joining us now to unpack some of those is Dr. Richard Besser. He's former acting director of the CDC in the Obama administration, now president and CEO of the Robert Wood Johnson Foundation. And for the record, we should note the foundation is a funder of the NewsHour. Dr. Besser, welcome back to the show. Thanks for joining us.
Great to be here. Thank you.
So Secretary Kennedy made a big claim in the hearing I want to ask you about. He said that America is the sickest country in the world. Take a listen to how he put it.
If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at the CDC. They did not do their job. This was their job to keep us healthy.
Dr. Besser, the U.S. spends more than any other nation on healthcare. Is it accurate to say we are the sickest country in the world?
Well, I don't think I would say we're the sickest country in the world, but I would agree with the Secretary that we're not getting the return on the investment. And a lot of that has to do with where we're spending our money. We're spending our money on healthcare services and rather than on public health and other approaches to prevention.
He cites as part of the argument there what he says is.
Let's talk about that for a moment. I don't know if we're the sickest country in the world. We appear to be sick anecdotally looking around. I see a lot of obese people. I see a lot of people who are having all sorts of surgeries and things removed, things fused, etc. I see a lot of junk food in the grocery stores, right? I see a lot of fast foods. I see a lot of sodas. I see a lot of energy drinks. It appears to be we have a health crisis in America. This is why I don't understand, why people are looking to the FDA and the government for guidance and advice, and whether it's, what you want to put into your body or what you want to, put into your mouth. Because they clearly are not doing a great job. Clearly they're not doing a great job, in my opinion, right? Let's continue.
Huge spike we've seen in the country in chronic disease. He actually made the claim that CDC data shows some 76% of Americans have a chronic disease. That number caught a lot of people's attention. Is that true?
Well, I would have to go back and look at that number and see what he's putting in there. But we have real challenges in America related to chronic diseases. It's one of those areas where I think if the Secretary were someone who really believed in using science and evidence to address chronic diseases, we could make progress. In the area of nutrition, that's an area where RWJF, our foundation, has done a lot of work. There's a lot that could be done to make sure that
I think that you see how he gives a subtle plug. I don't know. I mean, I think that a lot of people are making a lot of money off Americans being very sick. That's what my spidey sense is telling me.
Children in our schools were eating healthy school lunches, that schools had kitchens so they could actually cook real food for kids. But that's not what I'm hearing the secretary talk about.
Could that number be as high as 76% of all Americans, though? I mean, what are we talking about when we're talking about chronic diseases?
Well, I don't know what he's talking about there. You know, when the secretary was being confirmed, one of the things he said is that he's not a scientist, and you shouldn't look to him for scientific information. This is one of those situations where I would need to fact check that statistic. But I wouldn't argue that we have real issues in America with chronic disease. And it's something
I always like how these supposed experts they bring on to give us the goods always say, I can't really speak to that. We'll have to table it. It always gets tabled. Let's see what you're saying here. You have doctors calling people, taking their health into their hands, non-compliant patients. What healthcare system calls people that? Non-compliant patients. Okay, you're saying that they're not doing what the doctors are saying, calling people taking their health into their own hands, non-compliant patient. What healthcare system calls people that? Yeah. Trying to sort it out there. And let me, yeah, I agree. Let's continue here.
Where if you pull together the best and the brightest around science, we could make real progress.
There's another heated moment.
That's hilarious. They always are like, if we do this, we'll make progress. This is why I never, I analyze the news and I think it's hilarious. I never listen to it to get anything out of it. It's a comic joke, to be quite honest.
Lisa, report on there in the tape when Democratic Senator Mark Warner asked Secretary Kennedy about how many people died from COVID, and Kennedy answered, I don't think anybody knows that. Do we know the answer to that, Dr. Besser?
We do. When it comes to public health and data, you use all kinds of different tools to try and estimate what those numbers are. And we know that in the United States, over 1 million lives were saved due to the COVID vaccines. And we know around the world, millions of lives were saved. So for him to say we don't know, well, you may not know an exact number, but when you're talking about millions, that's pretty incredible. And it's one of the big accomplishments of the first Trump administration was how quickly we got so many saved.
Isn't it funny how they know exactly, or to take a stab at it, how many were saved from the COVID vaccine, but he doesn't know how many have chronic illness. Remember, he was like, I don't know, I'll have to look at. They know all the data of the things that make pharma money and that make corporations money. They don't know any of the data about how sick are we, how unhealthy are we. It's wild when you really analyze these clowns.
Highly effective vaccines to the people here in the United States, as well as due to the research from the National Institutes of Health for people around the globe.
Just to underscore that point on the efficacy.
That's a classic. That's a classic. What would you even call it? It's subtle misinformation. It's subtle manipulation. We know all about this, which we're pushing toward you, and we can give you numbers and data, but we know we're fuzzy on the whether you should eat healthy or whether you can, whether we have chronic disease. I think it's BS.
Of the vaccines, because the secretary was asked repeatedly about whether or not the COVID vaccine saved lives. He wouldn't say definitively, and he said he wanted to see the data and take a look at the data. What do we know about the efficacy of the COVID vaccine?
We know that the COVID vaccine is extremely safe and extremely effective. You saw differences in effectiveness based on which vaccines. The mRNA vaccines, the technology that the secretary is putting an end to, were extremely effective. And one of the beautiful things.
How can they know they're extremely effective when it was an emergency use authorization and they haven't gone through the rigorous testing that other VACCINES? See, this is what I'm saying. This is why I tell people if you choose to watch the news, I don't watch the news because I know what the news is. I know what it's designed to do and who makes the news. If you choose to watch the news, you have to be very, like I say, I don't enter into it because it's dangerous. But there's no way to know. They didn't go through the process. They didn't go through this 7 to 12 years. We have no idea the long-term safety, the long-term ramifications. We're 3 and 4 years in.
About those vaccines is how easy it was to manufacture them at a very large number, and how those could be adapted very quickly when there were new strains of COVID that were coming on the scene. So very safe, very effective.
He doesn't know.
No vaccine
He can't know.
is 100% protective, though. And that's why I'm so deeply concerned about the climate the Secretary is creating. We just saw in Florida, the Surgeon General say that vaccines for children going to school are optional. That creates a terrifying situation, and it is because of the climate that the Secretary is creating in our nation.
Dr. Besser, say more about that climate you mentioned. Big picture here, we just saw probably the most contentious hearing for an administration member so far this term. Even Republican senators expressing some concerns about what evidence, what science backed up some of Secretary Kennedy's decisions. What does all of that say to you?
Well, one of the things that gave me some hope in that hearing was that we were seeing
Just
bipartisan
another minute or two here
of some of the things that Secretary Kennedy is doing. Senator Cassidy, who chairs the Senate committee that oversees the department, really called out Secretary Kennedy around his unwillingness to celebrate the achievements of the first Trump administration in creating such effective COVID vaccines. He lifted up the experiences of people in his state who were having trouble getting vaccinated. And he said, this is not acceptable. And we need to see more of that, because it really falls on the Republicans to say that this is unacceptable.
All right. I think that's pretty much it. Let's jump over here into, I got some other videos queued up. Again, more around the general overall health and wellness. Like, look at this one. You've probably seen this. Check this out.
What American high school gym class looked like in the 1960s. This footage is from one of the 4,000 U.S. high schools that followed La Sierra's physical education program that was pushed to be the standard model by JFK. According to the La Sierra physical education standards that were outlined in their 1966 handbook, the minimum push-ups that a student should be able to do is 16, and they should have at least a 7.5-minute mile run. Considering most modern Americans struggle to even complete 5 push-ups, this 16 minimum is quite shocking. The top group that was outlined in the handbook is Blue Team, and to be a part of this, you had to be able to perform 12 handstand push-ups and at least 14 pull-ups, which are crazily impressive standards. Considering 1 in 6 modern American children have obesity, it is a shocking sight to see how seriously fitness and health were being taken in the 1960s, and how even the president was helping push forward this higher standard of physical education in school. Many people wonder if America as a country will ever return to a place even close to this. But considering the trends in obesity and the culture shift of America, it continues to seem unlikely.
Wild, actually, to see the level of fitness. Now, I'll tell you, if I was an evil person wanting to take over a country, I would make sure that the men and the women were as unfit mentally, physically, emotionally, spiritually, and financially as possible. Is it a conspiracy theory to think about this? Now, look at this one. This is Paul Saladino. He's actually just reviewing the same video here. Let me just see here. Watch this one.
If you're unhealthy and overweight in America, it's probably not your fault.
This is
and
good.
I'll tell you why. In 1980, about 15% of Americans were obese. Now it's 42 going to 43% of, so almost tripling of the obesity rate. 7 times as many people are suffering from type 2 diabetes or pre-diabetes. That's not because 35 years ago, people had more discipline or better diet programs, or they were better people, or they were exposed to less stresses. What has changed is our environment. Over 50% of all retail outlets, including the place you get your tires changed and the place you pick up your diabetes medicine, force you through a gauntlet of sugar-sweetened beverages, chips, and sodas. We make about 220 food decisions a day. Only 10% of them are conscious. The other 200 or so have been orchestrated by marketing and by proximity and convenience and really mindless decisions. And to your point, some of those bad mindless decisions are because of stress, but most of it is because of our unhealthy environment.
If you go into the grocery store, lately when I go to the grocery store, all I see is ticking time bombs. Sweets and pastries and candies and sugary sodas and all the other things. If that's a lot of what you can buy, it's a web of deception that I see cast upon America, and that's what a lot of people are going to get caught up in. It's just the way that it is. I don't know what else to call it. it does seem orchestrated to me. It seems intentional. The FDA has, all of our government has fallen down. We're in massive debt. Americans are in massive debt. Americans appear to be very unhealthy. A lot of Americans appear to be very unhealthy. I just don't know why people are continuing to look to the federal government for any sort of guidance at all, other than the fact of there's something in the water, it's in the food, it's in the air that is convincing people to look to those clowns for guidance. I don't know what it is. I hope we're waking up. I think we're waking up. I'm optimistic. Many people are seeing the truth of it now. People that used to believe. I always thought the government was incompetent prior to COVID. I just never had any use for them for 20 years because I studied food and nutrition 20 years ago and realized these mofos are putting all sorts of crap in foods, that cause chronic illness. After COVID, I realized they're very competent, right? They know exactly what they're doing. It is very clear to me there is a concerted effort with multinational corporations, including pharma, to weaken American people. What else could it be? Again, either incompetent or corruption. I'm well past the incompetent part. I mean, they can only use like that guy was doing. We got to get the data. We don't know. We're going to figure it out. They can only play that card so long, right? Before people start waking up to the fact of, hey, at the end of the day, it doesn't matter whether they're incompetent or corrupt. The results are the same. Anyway, there's my piece. I appreciate you guys for checking it out today. Thanks very much for your time. Take a look at photos from New York City in the 50s. Yeah, I've seen those. I've also seen them from the 70s, slender, very fit, people, all people. And I think a lot of what our obesity is in America is from the preservatives and the fake ingredients in processed food, because my understanding is that goes into the body. The body is like, what is this? I don't know what this is. I'm going to put it over here in fat storage until we figure out what this is. These are your, hydrogenated oils, preservatives, flavor enhancers, all the BS that is in this food to make it fake food, right? I think it goes into the fat cells. And just the body sits there and, put this on a shelf. It's like if you have a clutter in your home and you don't know what to do with it, you're just going to put it on the shelf and leave it there. And then I think that's a lot what's driving the obesity in our country. But that's a great example. Yeah, thank you for that. I appreciate that. All right, you guys, I appreciate you very much. You can follow me everywhere on social media at GMarkPhillips. I share different things, different places. And until next time, I wish you all the best health, wealth, and success. Have an awesome day.